So, if you'll all get your money in by Thursday, midday, this week, that's this Thursday at 12 o'clock, you can all go to the theatre next week, okay? And now, I'd like to introduce a more serious topic. I'd like to introduce you to Dr. David Sutherland, who's come along today to talk about the subject of AIDS. It's a very serious subject, concerns all of us, and I would like everyone to pay full attention. Dr. Sutherland, thank you.
Thank you very much. We're here to talk about AIDS because AIDS is very important. Why is it important? That's right. It's important because people are dying from AIDS and because AIDS is spreading. Now, the facts about AIDS are very simple. So what I want to start doing is giving you some of these very simple facts. And from that, the conclusions will be obvious. What does the word mean? What's AIDS? It's not a word, is it? It's an acronym. And an acronym is a series of initials. So we've got to talk AIDS. A, what's A? Acquired.
Anti.
Yeah, it is anti, but in this case it's acquired. That means AIDS is something you get.
That means you ain't got it, so you get it.
Get it?
Got it?
Have you?
No, not me.
Who's got it?
Not a bolt from the
He's
blue.
got it.
No, I ain't got it. I get it.
On the sodomites.
Got it?
AIDS is something that you acquire. It's the acquired. Now, what's the I? Immune. Right, it's about our immune system. We're talking about something to do with our body's defenses. The way we defend ourselves against viruses, bacteria and other sort of bugs, and against cancers. Now, in the context of immune, what's the D for? Deficiency. Right, we're talking about a condition with defective immunity.
Yeah, we've got a lot of mental defects around here.
You mean they haven't got any brains?
I mean, they haven't got something.
They haven't got an immune system that works, stupid.
Right, now if somebody knows what the S stands for, everybody gets early points. What's the S?
Syndrome.
Hooray, syndrome. Now, a syndrome is different from a disease. A syndrome is a whole lot of different ways that the body can respond. It's not like a cold where you get the sniffles, a fever, sore throat, etc., and eventually it all goes away. That is a predictable sort of pattern. In a syndrome, there's no special pattern. What does that mean? It means that if somebody's got AIDS, it may look as if they've got meningitis, it may look as if they've got gastroenteritis, they may have an infection in their chest, pneumonia, skin infections, they may get cancers, all sorts of different things. You can't go around the room and say, there's one, there's somebody with AIDS and everybody else is all right. This is a syndrome, not a disease. That's what we're talking about. Now, what causes AIDS?
Sex.
No, sex doesn't cause AIDS. AIDS is caused by a virus. Does anybody know what the virus is called?
A bloody nuisance.
A bloody nuisance, yeah.
All right. Thanks very much. Up the back.
It's called HIV. What's that stand for?
Wives.
He is virtuous.
He isn't virtuous.
He's in very big trouble.
What's that stand for? Human immunodeficiency virus. There's a problem though. This is HIV-1, and that tells us that this is only the first AIDS virus. The second AIDS virus has been recognised, probably the third, so I assume that we're going to have to expect the fourth and the fifth virus and so on. That's the virus we're talking about. Now, there is some good news about this virus.
There is good news?
Not much, but a little bit.
At least there is some good news.
The first bit of good news about this virus is that the outside coat is made of lipid. That means fat. Why do we care? Who cares what the coat is? We care because that means the virus is very fragile. It means it's very easy to kill this virus, and it means that if you think about it, you can kill it. What sort of things will kill it? Drying will kill it. You can kill it by heating. You can kill it by bleach, ordinary household bleach. And you can kill it with methylated spirits. That's plain, ordinary methyl. We can kill it by drying, by heat, by bleach, and by methylated spirits. But of course we can't take this internally because it would kill stuff that you buy, again at the supermarket or at the hardware store. All these ways,
If it works outside the body, why don't we just drink it?
That's why it has to be 70% methylated spirits. How much would you have to drink before 70% of your whole body was methylated spirits? Metho is very poisonous. It causes people to go blind and it rots their liver and things. You'd be dead long before you got to 70%.
Oh,
Right, so don't drink any metho.
all right.
Right, so there we are. First bit of good news, this virus is very fragile, and if you think about it, you've got a very easy way to kill it. Second bit of good news is we know how the virus is spread. This virus is spread in 3 ways, and in 3 ways only. Number 1 is blood to blood spread. Blood from one person who's infected getting into the bloodstream of somebody else who isn't. That'll spread it. The second way is by sexual intercourse. And the third way is that a mother who is pregnant can pass it on to her unborn child before or around the time of delivery. Now, they're the 3 ways it's spread. That's all the good news I have, unfortunately. We know about the virus and we know how it's spread. What about the bad news? The bad news starts as soon as this virus gets inside the body.
AIDS virus now arriving, platform 1. The virus enters the bloodstream. The body's defenses, the immune system is under attack. The immune system is in trouble and responds by calling up its troops. The antibody strike force is dispatched to combat the virus. Armed with a description of the virus, the strike force mission is to seek and destroy. The virus is diabolical, and problems arise when the virus changes its disguise, its outer coat. The antibody no longer recognizes the virus it has been sent to destroy. No longer attacking. And the virus goes on destroying the immune system.
So that the antibodies that were made today will be no good against the virus a few months down the track. That's one of the reasons why the virus isn't killed.
Can't you get something to attack the outside bit in its all its forms?
There are knobs on the outside of this virus. It looks like a mine with little knobs on. And these knobs are the things that change. They're actually sticking through the fatty coat. So these knobs are the problem. So that's the first bit of bad news, is that our own immunity can't handle this virus and it grows. The second bit of bad news is as the virus grows, it attacks the very cell that should be responsible for killing it. It's called the helper cell. And the helper cell is the starter motor of our immunity. No helper cells, no starter motor. You can have 5 litres of chromed, overhead cam, go faster stripes, Venetian blinds on the back window, but you're not going to go anywhere without a starter motor. Our body's immune system needs a starter motor, and that's the helper cell. And this virus attacks the helper cell. Third bit of bad news, not only does the virus do that, but it gets into our genes. And it gets right into the genes, in amongst the bits of our genes that say what our blood group is, our eye colour, our hair colour, and so on. And once it's there to stay.
It's got into my genes.
I can see that, yes. The virus has now infected the only cell that can protect the body against infection. And to kill the virus, we'd have to kill all the infected cells. And that means killing off the immune system.
So what is that supposed to mean?
It means we're not going to have a cure for AIDS unless some wizzo comes along with something they haven't even thought about now.
It's obvious that we're not going to get a vaccine. We're not going to get a vaccine because our body doesn't know how to deal with this. We're certainly not going to get a cure, not in the next few years, because once the virus is in our genes, it's there to stay. We've got no cure, no vaccine. But what we do have is knowledge and education on how not to get it. We have no cure and no vaccine. So what we've got to do is go back and look at the ways that this virus is spread and make sure that we can persuade people not to place themselves at risk. Now, the first one was blood-to-blood contact. Blood from someone who's infected with the virus getting into your bloodstream. Now, until 1985, that meant blood transfusions. Blood-to-blood contact. Blood from someone who's infected with the virus getting into your bloodstream. But in 1985, right through the Western world, all blood products are treated and all blood is screened thoroughly.
Excellent vintage.
That means blood transfusions. But since that time, right through the Western world, all blood donations are tested for the AIDS virus, and therefore blood is now as safe as it ever was. Yeah.
So, if having a blood transfusion is pretty safe as to not get it through blood to blood,
Yes.
how else would you get it through blood to blood? Could you get it through a cut?
Well, you tell me, what's the next most important way that blood transmits from one person to another?
Smacking them in the head?
Can we have an advance on that?
Smacking 2 people.
That's twice as likely, yeah. How about shooting up? When people use intravenous drugs, what do? They share their needles and syringes. And when the gear passes from the first person onto the second, it takes some blood from the first that's injected into the second. And that is now the most important form of blood-to-blood spread. That means intravenous drug use or the use of needles and syringes for any other purpose.
Oh, hurry up.
It's all right, it'll come.
Is it my turn now? I'll sterilise the needle first. I don't want to get AIDS.
Okay, I'll sterilise the needle. You ready?
Yeah, okay. Lie back. Oh, look, I'll go to the hairdressers for ear piercing. I mean, they know how to do it properly and everything.
Somebody mentioned these other, more accidental ways. Yeah, there are other ways of getting somebody's blood into your bloodstream. And we think about sharing tattooing needles, piercing ears and sharing the needles, all those kind of things. And yeah, in an accident, if somebody has got a cut and fresh blood from somebody else gets into their cut, at least theoretically, that's a possible way to transmit it. Obviously, in this context as well, we have to think about sharing of razors and toothbrushes and so on. But let's not get away from the main point. The main risk of blood-to-blood contact is the sharing of needles and syringes with intravenous drug use.
Can a mozzie have it and give it to you that way?
The answer is no, a mosquito can't. The AIDS virus only grows in humans. You can just get it to grow in chimpanzees, but even there it doesn't cause an illness like AIDS. So the answer is no, a mosquito can't. And it can't be transmitted that way. And that brings us to sexual intercourse, and that's the one that gets everyone excited.
Well, not everyone.
What are you saying?
Problems, right?
We've got to talk about at least 3 different practices. Now, the one that's attracted all attention is rectal intercourse.
That's a dick up the bum.
That's right, thank you very much. That is when somebody inserts a penis into the rectum or the back passage. Now, this is regarded as a male homosexual practice, sex between 2 men, but a proportion of straight people, men and women, also practice anal intercourse. This is the most dangerous practice, but it's not the only one. The virus may also be passed from a man to a woman and from a woman to a man by vaginal intercourse. That's ordinary straight sex. Can pass both ways. What about oral sex? We simply don't know about oral sex. It's very difficult to find a group of people who only practice oral sex and don't do the other things as well. Right, 3 sorts of sexual intercourse. 2, rectal intercourse and vaginal intercourse, we know is dangerous. We better assume that oral sex is dangerous too until further notice. It doesn't matter what form of sexual intercourse we're talking about. Male to male, male to female, female back to male again. They're all risky. Remember, it's not who you are, it's what you do. Yep, we can rank the risk and we can say, yes, anal intercourse is the most dangerous form of intercourse. But let's take that now and put it up the other way and let's talk about the safest form. Now, there are 2 forms of safe sex. The first is no sex at all. Yeah, cries of anguish. Now, the other form of safe sex is when 2 people are both free of the virus. And they only have sex with each other. In other words, they're both faithful, neither's having anything on the side, and neither is exposing themselves to risks by other means such as shooting up. That's safe sex. That is the only safe sex.
Want to come inside and fool around?
Not me. I'm, practicing safe sex.
Come on, what's that supposed to mean?
Oh, for me it means no sex at all.
What do you play at? Monk of the month or something, are we?
Yeah, that's me. Monk of the month. Or monk until marriage, or monk until monogamous.
Monogamous?
That's safe sex. That is the only safe sex.
Look, I told you I was safe.
All right, up the back. I've asked you to listen. This is important to everyone. If you don't want to listen, everybody else does, so give them a chance to hear what's important to them, will you? If you don't, I'll have to send you to the principal's office. Again.
Right. Now, that's the only forms, they are the only forms of safe sex. Everything else is safer sex. It's a matter of reducing the risk. There are always going to be people who say, look, I'm sorry, this is not acceptable. I want to sleep around a bit. I need to get some experience. Well, what can we say to people like this? All we can say is the greater the number of partners, the greater the risk. And that's rule 1. More partners, more risk.
Yeah, the more partners your partners have, the even greater the risk.
And the more partners your partners have.
we understand you were not listening to the AIDS lecture. We have ways of determining if you understand the implications of this. Where were you on the night of Saturday following the HSC?
I'm only required to give my name and student number.
We have ways of making you talk. Igor! Don't say it, don't even think it. That's exactly what we want to know about. Who were you with on Saturday night?
No, I wasn't with anyone.
Igor?
I was with Shirley. I was with
And who
Shirley.
else?
I was with Shirley and Sandra and...
We want to know the entire story, lad.
I was with Shirley and Brenda and Jenny and Betty. No, that was last week. George, there was George, but it was only the one.
And of course, it may only take once to contract the virus. A single exposure from an infected person could infect you.
That's a real worry. Some of my partners really sleep around.
It's best to be sure, but if you can't...
And who can these days?
You must use a condom.
Hang on a minute. There's something I'm really worried about. I mean, it's about AIDS. Can you be trusted?
Would a man lie to you at a time like this?
Well, I'm not taking any chances. It's condoms or nothing.
Okay.
It's best to be sure, but if you can't, you must use a condom. But condoms are not perfectly safe.
They're certainly not 100% effective against pregnancy.
Right, 3 reasons. Number 1, they break. Number 2, they come off, and the usual time they come off is at the end during withdrawal, when the man's withdrawing. And number 3, they're not used. Can't be found in the back of the Holden at midnight on Saturday. Somebody doesn't want to go out in the rain and get them on Sunday afternoon. You can get round this by having condoms and knowing how to use them. Why not do a little bit of homework beforehand?
Look, I can't read this because the printing's too small, and besides that, I've never had to use these things before.
I know. I can't read it either. And besides, your heavy breathing's fogging up my glass.
Make sure you know how to put them on. And that means reading the instructions in the daylight. And by the way, there's no need to blow them up. They've all been tested. But do make sure that they're not out of date. Each packet will have an expiry date on it. Now, when you buy the condoms, they come in a strip like this usually. Tear them open. Take the condom out. There are 2 things you've got to look at. It is rolled, and secondly, there's a teat on the end of it. When the condom is put on, it is very important to squeeze the teat. If an air bubble is left in the teat, when the condom is used, that may cause it to break. Remember, we said the cause of breakage of condoms is when they're not put on properly. The bubble is squeezed, the teat at the end is squeezed. Then it's put onto an erect penis with the roll on the outside. If the roll's the wrong way round, it won't roll down. It goes onto the erect penis and is rolled down. And it is rolled all the way down.
Okay. Yeah, I think that's close. Yeah, that's it. I'm sure this is how the guy showed it in class. What do you think?
Oh, Wayne, really?
And it is rolled all the way down. Not halfway, yeah.
I think you've got a bit of a problem there, Doc, because most people tend not to put it there. They tend to put it on the old fella.
Very good. That's good. I'm pleased to hear that.
Yeah, you put it on your dick, Doc.
All right. Thanks very much. Up the back.
Right. Now, as we've said, the next problem is what to do at the end of intercourse. And somebody's got to hold it on during withdrawal. Doesn't matter who holds it on. Doesn't matter if you both hold it on. But somebody's got to hold it on during withdrawal. Then what do you do with it afterwards? It's got to be disposed of, doesn't it?
Well,
I'll just go and make a quick deposit in the loo with this.
Oh no, think of the pollution.
But doesn't it get broken down in the sewage treatment or something?
No, they'll be floating around in the sea for years. Just think of the poor fishies.
So do you want me to wrap it up in paper and put it in the rubbish bin or something?
Well, of course, silly, and put it in a plastic bag.
And so, when you've done the right thing and used a condom, remember, do the right thing.
Do the right thing. Do the right thing.
Do it right. Keep it out of sight. Drop it in the bin.
Do the right thing. Do the right thing. Do the right thing.
And so, the trick is to stay out of the high-risk categories altogether. Blood-to-blood contact, sexual transmission, and mother to unborn child. So we've done blood-to-blood spread, we've talked about sexual intercourse. The third way of spread is mother to unborn child, or mother to child around the time of childbirth, because it may actually occur during childbirth.
Would a caesarean section sort of stop the baby getting AIDS?
No, because we think on most occasions the virus has already crossed the placenta while the baby's in the womb. So in most cases it would be too late. That's it. They're the only ways it's spread. Now, if they're the only ways it's spread, how is it not spread? We've already talked about mosquitoes and biting insects, and it's not spread that way. It is also not spread by social contact. Sharing cups and saucers and plates, bathrooms and toilets, hugging, kissing, shaking hands. Right, so you know how it's spread. What's the future hold for the people in this room? We need to look at what's happened in the United States. Because in the United States, the virus has been around for longer, since 1981. Let's go figures till the end of 1987, and then we'll make projections for the future. And this is what's happened in the United States. $70,000 cases. Now remember, what we're talking about here is full-blown AIDS, not people carrying the virus. If there's 70,000 people carrying with full-blown AIDS, how many might be carrying the virus? At least 1 million. At least 1 million.
But how come we don't know anyone who's got it?
How do you know you don't know anyone who's got it? Have all your friends had a test?
No.
Right, then you don't know, do you? That's the United States. What's happening in Australia? The figures are paralleling those in the United States, like this. Soon to reach 1,000 cases of full-blown AIDS. How many people out there in the community, and this is coming back to your question, how many people out in the community right now carrying the virus, not knowing they've got it, and doing to other people what someone did to them to give them the virus? The estimates vary from 50 to 90,000. 50 to 90,000 people in Australia right now out there carrying the virus. That's why I say, how do you know that someone you know hasn't got it?
Will a blood test tell you if you've got the virus, if you're carrying it?
Yes, it will. There is a certain period called a window period, which may be as long as 3 months, usually 4 to 8 weeks, before the test becomes positive. In other words, if you go out and have a good time tonight, there's no point in getting tested tomorrow. It takes 4 weeks, 8 weeks, maybe even 12 weeks for the test to become positive.
So how do you get tested? Where do you go?
You need, in most places, you need to see a doctor. Now, there's lots of places you can do that. You can go to your own family doctor. You can go to a hospital, STD clinic, sexually transmitted diseases clinic. In some places, there are walk-in centres where you can just walk off the street. That's the way you get the test done. It's free and it's confidential. This is what you're looking forward to in the future. You're looking forward to the certainty that you're going to meet people out there with the virus. We're talking about a syndrome with no immediate prospect for a vaccine, with no even medium-term prospect of a cure. All we've got is prevention. It's your body, you have the information, and it's now.